Welcome to Busy Mom Talk, real talk for real moms. I'm your host, Kia, mom of two. So if you're juggling kids, coffee, and chaos, you're in the right place. Let's get into it. The information, opinions, and recommendations presented in this podcast are for educational purposes only, and every individual should seek medical advice from their own medical professional regarding their medical status. Welcome back to another episode of Busy Mom Talk, the podcast. We have the third episode with Dr. Stu, and if you haven't listened to episode 1 and 2 with him, go back and listen before we get into this amazing episode.
And there's a thing called the medical gaze, which I learned from my friend Melanie Jackson in Sydney. The medical gaze is very interesting. The medical gaze is when doctors hear your story. What they're hearing is the pathology. They're hearing that Kia is pregnant and Kia has a kidney infection. And their focus doesn't become Kia anymore. It becomes Kia's kidneys. So the focus of their attention becomes the disease and not the diseased person. And they lose focus on that. And I never thought of it that way, but it makes perfect sense to me because we are taught in a model in medical school and residency to cure disease. So if pregnancy is in our purview, then it must be a disease. And even the American College of OBGYN says pregnancy itself is a high-risk condition. Now, if that's the prism by which all medical students and residents are trained, then you can see why everything they look at in you is something that's going to go wrong. And so from the very first prenatal visit, you are being exposed to their fears and saying things like, your hips are small, you're over 35, your mother had C-sections. Why are they doing that? They're projecting their own problem list onto you, as if that's good medicine. But it's not good medicine. But it's the medicine that they learned, and that's all they know. And until they are forced, like I was, well, I wasn't forced, but I mean, I took on backing midwives, as I said, not because I thought home birth was a good idea. I'm pretty sure that I came out and I probably thought it was stupid. I did it to make money, but it was a fortunate turn of events for me because I began to see that what I was doing was stupid. Why am I taking a baby to the warmer? Why is a woman on her back giving birth? Why am I cutting a medial lateral episiotomy on every single woman when I was a third-year medical student at St. Joseph's Hospital in St. Paul, Minnesota? Every single woman, first baby, fifth baby, got a medial lateral episiotomy. So she wouldn't tear into her rectum with the fourth degree. But I don't think in my entire home birth career I had maybe one of my own fourth degrees. I got called occasionally to a birth with another midwife because I was available, if I was available, to come and do repairs at home so that the woman who had the home birth, who had a third or fourth degree tear, didn't have to go to the hospital and leave her baby behind and get separated and stuff like that. I provided that service for a fee, obviously, to keep women at home. But fourth degrees are extremely rare. The fact that I cut a medial lateral episiotomy as a third-year medical student on every single woman to avoid something that's extremely rare while giving them a scarred gluteus muscle, what was I thinking?
Yeah.
We were told as residents, and even in my early years as an attending, to give women shots to dry up their breast milk so they could bottle feed without getting engorged, because we told our patients that bottle feeding was better. That's what we were taught. And the pharmaceutical companies and the companies, they wined and dined us. There were no rules then about how much they could do for us. And they took us to Laker games and they brought us nice lunches and they had beautiful gift bags that we could give to our pregnant women that said Enfamil or Similac on the outside of them, and very, very nice tote bags. And we did that. And I did it without thinking. And the midwives woke me up. Much gratitude to them.
Well, I would think, though, that when you're going through a very extensive, expensive degree, you're going to do everything that you can to excel at your career, right? So most people don't go into medicine and think, I'm going to take the other way. I'm going to drive away from the medical term because they don't realize how neglectful it is almost, right? So I know so many people, I have lots of friends who are nurses and stuff, and they say how drained doctors are and how it's just like another patient. Like they don't even really see the patient. And my OB used to always say like how important the nurses were because they do 95% of the work. He comes in when it's time to deliver the baby and he gets all the respect and all of the, oh, thank you so much. But like he doesn't do anything. He just sits there and monitors it, observes it. When something goes wrong, he comes. But like when you're the resident, you're just thinking, okay, how do I get to my end goal of becoming an attending? How do I get to my end goal of where my career is going to go because of what you've just gone through, right?
Yeah, that dredged up an old story from my residency program where we had continuity of care in our clinic, and so we had our own clients. This was in the early '80s, and I remember I had a woman that I took care of through her entire pregnancy. And when she was in labor, I was very attentive. I wasn't the nurse, but I was around the whole time. And then she got to completely dilated, and I got called to the OR for an emergency, I think a ruptured ectopic pregnancy or something like that. So I ran off for like 45 minutes to do this surgery. I was the chief resident, and I came back, and my colleague, one of the other chiefs, ended up catching her baby. Her name was Bonnie, my colleague, catching her baby. And I took care of this woman postpartum, and I felt really bad but I had to go save a life, technically speaking, and do this ectopic pregnancy. And the next day, Bonnie got a dozen roses, and I got nothing. And I had taken care of her for her entire pregnancy. But yeah, as you said, the doctor gets the glory of catching the baby. And
Yes.
that's a cultural thing that we have indoctrinated women to believe that doctors are saviors and they're going to catch your baby. And again, sometimes they are, but most of the time, you deliver your baby and the doctor's there to facilitate it, the midwife's there to facilitate it. And the midwifery model honors that far more than the obstetric model. In many hospitals, doctors don't know what to do if you don't want to be on your back with your legs up in stirrups.
Yeah.
They don't know how to catch a baby if you're on all fours or squatting. They're not comfortable with it because they're not trained to do that. If they would just spend a little time with midwives and watch some home births or watch some midwives do hospital births, they'd know this, but they're not interested because they're task oriented. As you said, they're on to they come for the last 5 minutes and they catch the baby and they write the orders and then they go on to the next task. And the women are outside their line of sight. It is the medical gaze I just described to you. The woman becomes whatever her disease process is what they focus on, and they don't know. And a lot of times they don't know the woman's name, and they certainly don't know her partner's name.
Yeah.
How hard
It's
is it
true.
before you walk in the room is to look at the woman's name and look in the chart and find the husband's name and greet them as you walk in? Can you imagine how we could change the world with just simple things like that?
Well, so for example, I don't know if I've just had a very unique, strange birth or pregnancy. Like with my son, because I was hospitalized for so long, I knew majority of the nurses and I knew a majority of the doctors. And I became on a first name basis with a lot of people because it was so strange that they couldn't. I had an enterococcus resistant antibiotic infection. So because they could not figure it out, even when I came for my second pregnancy, a lot of people remembered me because of how strange my case was. And it did make me feel like, okay, I do want to still be here because I felt more connected to them. But when I had a little okay, so maybe I'll explain it. I've never ever told the story. My partner might give me a
Well,
little bit
I'm
of,
honored. I'm honored to be the
yes,
recipient.
he might give me a little bit of shit for saying this, so excuse my language. But so when I was 36, no, 35 weeks pregnant, I went into labor and delivery because I thought I was leaking fluid. And they did think that I leaked a little bit of fluid, but nothing was super worrisome. And they sent me home and they said, if you have any other issues, come back in. And I was super hesitant to ready go because of my issues with the resident in the beginning that I raised awareness to, that I was supposed to go for a hearing in front of the medical board. And when I got a call at 36 weeks to come in early for an appointment, that something came back positive on my urine culture, my swab. And I'm like, what swab? And they tell me that I have an STD called trichomonas. And
Yeah, trichomonas.
And I'm like in tears at this point. My partner was working like 60 hours a week. We have a little boy at home. Like, what do you mean I have an STD? I've never been positive for an STD in my life. I didn't even know I was getting tested for STDs. And they tell me to come in. So I'm with my OB, who I've known very well. I'm sitting there talking to him for over an hour, hysterically crying because I don't understand how this happens. I'm like, can he get it from a porta potty? Can he get it from sharing a smoke? I am asking every question in the book. And he's like, it's a 99% positivity rate that it's true. And he's like, this conversation is never pleasant with anybody, let alone being pregnant. You're supposed to be having your baby next week at 37 weeks. They were going to induce me. They're telling me that my baby could be put in the NICU. So I'd pack all of my partner's stuff up. I'm like, you're kicked out. You gave me STDs. And he's just apologizing to me, saying, like, I forgive you. I forgive you to me. And I'm like, I didn't cheat on you. And we're going back and forth. So he has to go get tested. My OB told me, don't take any medication until we have 2 positive tests. So I get tested in the office. They send me a script, but he tells me, do not
Don't
fill
take.
it until after we call you. And then my partner goes to get tested. His comes back negative before mine does. So he still again thinks I cheated on him and he's going, I forgive you. We'll get through this. Don't worry about it. Just relax. You're pregnant. And I'm like, get the fuck out of my house. I'm freaking out, right? Like, of course, like I'm 36 weeks filled with hormones. And then 1 o'clock in the morning, like two days later after I get tested, it's negative. They call me back in the morning and they're like, oh, sorry. We're going to test you one more time just to be sure. Go and get another test. 24 hours later, 48 hours later, they call me and they go, it was probably just a mix up. They probably just put your name on somebody else's swab. Sorry about that. And I'm like, what do you mean sorry about that? You just like tell us still to this day, there's negative side effects from that whole ordeal. And again, I had a bad birth outcome, and I swear there is a correlation. And ever since then, I've been so hesitant about going to a hospital, a doctor, because I'm like, you guys are going to screw me over. No other doctor or hospital in the area would take me. And I think that they just seen that's just a lawsuit written all over it at this point, right? And there was just no acknowledgement, whatever. And it was the worst week of my life.
I'm sorry to hear that story because it could have ended up a lot worse for you and your partner uh,
Yes,
because of either a screw up or a false positive. But it just goes to show you that testing should not be taken lightly. And when test and here's a broad, bold statement. Testing should never be routine,
I agree.
but it is. The first prenatal visit you have, you'll have routine tests done. You should challenge your doctor and say, why am I peeing in a cup? Why are you sending off a urine? What's the downsides of doing that? Why are you drawing my blood now? I know my blood type is O positive. I know I'm antibody screen negative. Why do you have to repeat it again? I know I'm rubella immune. I don't want to have that drawn again. I know I'm not doing drugs. You're not going to drug test me. I know that that my thyroid was normal. I had it checked 3 months ago, and why am I doing all these things? Because what happens all the time, and when I say all the time, I mean commonly, is you get a false positive test, and then you have a couple weeks of anxiety for no reason. Um, and even later on in the pregnancy, you could say, okay, I've got a little bit of itching. So they check you for cholestasis and they check a bile acid level. And it comes, anything lower than 10 is normal and above 10 is considered elevated. And it comes back at 12. So now you're labeled that you have cholestasis of pregnancy, which of course, they'll immediately think that well, if you're close to term, you should be delivered because the rate of stillbirth goes up when you have cholestasis of pregnancy. But it actually doesn't go up until your levels are closer to 100 or above. But you'll still be labeled with cholestasis. And even if your levels go back down to normal, the diagnosis of cholestasis will stay on your chart. That's what happens.
Why is that?
Somebody, that's because that's how they're trained. Obstetrician charts have a problem list. If you're screened for diabetes and it's set at a certain number, there's going to be a lot of false positives. And they're going to either make you do a 3-hour test or they're going to make you buy a glucometer and do finger stick testing and all that stuff. And that's going to come back normal, but it's still going to be on your chart that you failed your 1-hour test. And and some doctors are going to say, well, you're pre-diabetic. We probably should induce your labor at 39 weeks. there are consequences to drawing labs routinely.
Yeah.
But the system doesn't allow for individualization of care because they don't trust the doctors to do it right. They go through all this training, spend all this money and all these years of their lives, and coming out, and then they're being told, like I said, by some maternal fetal medicine devised algorithm that this is how that we're all going to treat all women in our system. They all need this test at 10 weeks, and this test at 12 weeks, and this test at 20 weeks, and this test at 28 weeks, and these shots at 28 weeks, and this shot at 34 weeks, and these testing begin twice weekly at 36 weeks, and that's how we're going to do it. And again, everything I just told you generates revenue.
Yes.
Imagine what prenatal care would look like if they paid more for doing less. If doctors got
They'd
more,
go bankrupt.
or they'd start doing less.
Yeah. Oh, yes. They would
Right.
do less. Yeah.
Right. If they paid more, say they paid twice as much as they do now for a vaginal delivery, and they paid only 30% of what they're paying now for a cesarean delivery, then suddenly you'd see VBAC and breech become more popular again. What if they paid you more per birth if your C-section rate was below 20%, and
Yeah.
less if it's between 20 and 30%, and if your C-section rate's over 30%, you get paid less for every birth that you do. You might have doctors giving you more time. You might be more patient because they know that their salary is now dependent on their outcomes, not on their their ideas or their thoughts or their tendencies. I'm dropping the word that I'm trying to come up with. Intentions. It's not on their intentions. It's based on their outcomes. If we had outcomes-based reimbursement, we could start to change the world. Re-educating young girls to know to ask the right questions so they're not scared of that. It was another way to do it. Bringing back continuity of care would be a great thing to do. Who, like any other big business, who makes the most money in healthcare? It's the people that are the middlemen, the people that manage. Yeah. It's not the doctors and the nurses. It's not the people on the front lines, the grunts. They can't make like going into medical school now and becoming an obstetrician is not, or a pediatrician is not a way to make money. You're not going to make money. You want to make money, you go into Botox or plastic surgery or fertility issues and things like that, where you're outside the insurance realm and you get paid cash and you're in demand, those sorts of things. But doctors want to go into it, I think, for a calling. And if they only knew before they started that long journey that they're going to end up coming out and not being captain of their own ship, I'm not sure that, and they're going to be, and have several $100,000 worth of debt that they have to pay off over, and not be able to own a home until they're in their mid-30s, that sort of thing. I don't know that they would do it. I think the beauty of youth is that they're naive and enthusiastic. So we're never going to run out of people who have who want to do good. And you mentioned earlier about people that have the thinking that you and I have, and how do they survive 8 years of medical school and residency? It's very difficult. I get probably every couple months, I get a pre-med or a medical student saying, I had my births at home, or I was born at home and I want to do this. Do I just have to plug my nose for 8 years? Is that what I have to do? I just have to and will I come out intact on the other side, or will I be tainted? And it's a difficult question to answer. And it really depends on what they want to do. But if you want to really make a change in the profession, becoming an OB is the way to do it. But the beatdown is pretty strong. And so you have to have really strong fortitude to get through that, and then realize you're fighting an uphill battle because you're fighting a monolithic system that is quite happy the way it's working, because they're not interested in having better outcomes. They're interested in profits and power, like every other big corporation. It's disheartening for people listening to this who think that the medical system has their best interest at heart. And your local hospital may, and you may be related to somebody on the board of directors, and you may have a great relationship with your hospital. So this is not for you. But this is for the majority of people in your country and my country. Your country, by the way, if I can say this on your podcast, has gone off the deep end.
Oh, yeah.
I'm coming to speak at the Reclaiming Birth Conference in a few weeks.
Yes, I have seen that.
In London, and I'm not exactly sure. I think I'm going to speak on twins, but I don't know that I'll be able to hold my tongue about some of the things that are going on in your country with regards to the tyranny of healthcare. and
Yes.
many other aspects of it. I just don't know what happened. I mean, I grew up with so many Canadians as my friends and just loved going to Canada. And I still love going to Canada, but you almost have speech police now.
Yes, it's true. Like we can't even see news on Instagram or anything like that. It's completely blocked. And, I used to think that I did my undergrad in global law. So I used to think law was just in law and politics were just like news and law and political stuff. But now I've realized politics are in every little aspect of our life. Like there is no way to get around it, out of it. It's just, yeah.
Well, let's end on a bright note because I have to go.
Yes,
So
yes.
let's.
So what's one last thing? So one last question I'll ask you is what's the one thing that is like the reason that you do what you do? Like the one thing that you go home every time that you do something and you're like, this is my why.
I will tell you that it's because I see such beautiful um, rewards for the women, not for me, but the stories that they write me and the stories that I see posted, and the idea that nothing is more important than the health of our future children and our future immune systems and things start in the womb. And so for me, what I do is really easy. I know that I'm not going to, I accept uncertainty. I know that I can't answer everybody's question and give them the answer that they want, or that I know what's going to happen. But it's uncanny to know that I can predict what's going to happen when they go to the hospital. It, and um, that's such a broad question because there's so much about what I do that I love right now. Um, I miss being at a birth, but I do not miss being on call. Being on call was a very wearing thing for me, and I was on call for almost 36 years, solo everywhere I went. Even when I was on vacation, I had carried my pager early on, or my cell phone, obviously, and I would take calls, and if it was something I could deal with the client over the phone, because I knew my parents raised me in a way that the original golden rule really applied, and that is do unto others as you'd have them do unto you. And I wanted to give my clients treatment the way I would want to be treated. And I knew that if they called me, that they would get an ear that cared and that listened. And I can tell you that I covered other doctors on call, and I didn't treat their patients as the same as I treated mine. I didn't know them. I didn't have that background in relationships. I didn't know if this is something where I can make a little sense of humor, or if I can ease their mind by saying something in a certain way. Some women didn't want to hear that. They didn't want to be talked out of getting a prescription for their cold. They wanted that antibiotic, even though a cold is a virus. Antibiotics don't do anything for it. They wanted that prescription. And if I would spend time with them, that's not what they wanted to hear. So there's a satisfaction in doing what I've been trained by midwives and taught by midwives to deal with this continuity of care and to really respect the sanctity of the birth process, understanding that how we start out in the world, both as a baby and as a woman, as a mother, has ripple effects that are beyond our imagination. We cannot comprehend what it does when women are empowered to do the things and give birth the way they want to, and give them the choices so that they feel that they've made choices. And again, I want to say this to include their partners in that. I was very fortunate in that I have a very easy time dealing with the men. When they came to the office, we encouraged. Sometimes we'd have office visits at 5 or 6 o'clock at night because the men were working, and so they would come, and we would just do it because we wanted the men to be part of the process. And sometimes the mom would go off to the bathroom, and I'd look at the dad, and I'd have a conversation with him. So how's it going? Tell me what you're feeling. And it's like nobody asks them that.
Yeah.
And in the hospital, they're put in some silly hospital cover gown. They're sat on a stool in the corner. They're pushed off to the side. It's very disempowering, and it's also like disheartening for the woman to watch her man be emasculated. She's maybe getting abused by a vaginal exam that she doesn't want, and her man doesn't know to speak up. And
Oh
then
yeah.
you never quite look at your spouse the same way again if you feel traumatized, because you feel that the trauma occurred on his watch. These are things that I would never have thought of in medical school or residency or in private practice. I owe this to the traditional midwives. Like my co-host Bliss has taught me so much, and all the people around her, and the traditional midwives that she's interviewing now on her Bridge Midwives project, and my friends Alex and Beth and Carney, and I don't want to leave names out. There's so many in LA that really re-educated me. So I am grateful that I had a great career. I'm a little pissed off that age does catch up with us, and we don't necessarily want to be up at night all the time anymore. But I think that there's really nothing more important in a family's life than having really good memories of the birth of your children, because you'll remember that moment all your life. And I mean, you were already talking to me. You've told me stories today of trauma that still exists inside of you, that had you had a different set of circumstances, you may not have experienced. And it does affect you. And that's probably partly why you're doing what you're doing, Key. And
Right on.
I think it's great what you're doing. And I think that whether you reach 1,000 people or 10,000 people or whatever else, those people will reach other people, and there will be ripple effects. And the one thing that I would ask your listeners to do when they go to their OB for the first visit is don't just pick your OB because that person's been doing your pap smear for a decade. Do your research, just like you would if you were planning your wedding, or just like you would if you were going to move to a new community. You check out the schools, you check out the parks, you check out the hospital, you check out the churches. You would check them out. So check out your OB. Ask the nurses in labor and delivery what they think of the OB that you are thinking of hiring. Go in for that first visit, and don't let them do anything to you. Don't let them draw blood on you or take your blood pressure or anything. You're going in to interview them, and you're the consumer, and you ask them, if I go past 40 weeks, what happens? If I break my bag of waters and I'm not in labor, what do you do? If my baby's breached, do you deliver vaginally? Oh, why not? You know, ask these questions. And if they give you the time of day, and if they look you in the eye and they give you answers that make you feel safe and secure, then that's a good fit. And if they don't, then run to the hills. That is not the practitioner for you. Do not settle because your insurance card says you have to go here or there. This is a life event. Save money for it, put it away when you're young, use it wisely to hire, if you have to hire a home birth midwife and you have to pay out of pocket because your insurance is idiotic and doesn't cover it, even though they'd save money if they covered it, then do that and find somebody who really knows you, who looks you in the eye and knows you. And when you come in for the third or fourth visit, they ask you a question about something you talked about 4 weeks earlier. Like, how was that interview you had? Or how did Jimmy do at his soccer match? And then it becomes not just a profession, it becomes a life. And that's what I would tell for people in the business is make it your life, make it enjoyable. I can just tell you, most of my obstetrical colleagues, as I said earlier, they're not happy. They're not happy. Your doctor sounds like he might be, but most doctors are not happy because happy people do not treat that way. You can't get as much job satisfaction working a shift. Imagine being with a woman through her entire pregnancy and then not being there for the delivery, or being with her through her labor and then she's starting to push and 7 o'clock, I gotta go, and not seeing the culmination of your work. It's very unsatisfying. We need to make changes in all aspects of it. And the people that have run us into the ground, the Royal College, the American College, Royal College is better than most, and your society and my ACOG and the Society for Maternal Fetal Medicine, they really have blown it. They have brought us to a point where our outcomes have really never been worse, despite all their interventions, and they really should have no place at the table. My country may or may not see changes being made through the Health and Human Services Department and the MAHA movement, the Make America Healthy Again. I hope you guys have a MICHA movement, Make Canadians Healthy Again, because, yeah, this is our calling. This is what we should be doing. Yeah, just following an algorithm and keeping your head down so you can pay off your student loans and make a salary, it is not a satisfying life. And you will look back at your career and you will wonder, what the fuck was I doing?
Yes,
Right.
yes. Well, thank you, Dr. Stu. I truly appreciate it. This was an amazing conversation. I'm so thankful to have been able to connect with you. And I look forward to hearing back from everyone who's going to be listening because I think that this was such a good podcast. So thank you.
Thank you, Keith, for having me. And comments would be really welcome. I learn from them, and it helps me guide what I say to other people in the future. And I've been blessed. And I hope I live as long as Michelle O'Donnell did and can continue to contribute to some degree the level that he did because again, I've had the good fortune of spending some time with him. So I feel very lucky about that. Thanks for having
Yes.
me on. Bye.
Thank you, Dr. Stu.
Okay.